Number 151. A 6-year-old boy is brought to the hospital for a third episode of sore throat in 1 month. He is found bleeding from gums and nose and has pale conjunctiva. What is the single cell type? Option A, clumped platelets. Option B, microcytes. Option C, granulocyte without blast cells. Option D, blast cells. Option E, major lymphocytes. So the key here is option D, blast cells. Its diagnosis is acute lymphoblastic leukemia or ALL. So the spotting points here is the boy is 6 year olds with recurrent infections, neutropenia and thrombocytopenia, that is bleeding, anemia and pale conjunctiva. These spot. So the correct option here is option D, blast cells. Question number 152. A 23-year-old man has been stabbed in the back and has shortness of breath. The trachea is not deviated. He has engorged neck veins and absent breath sounds on the right. What is the most appropriate diagnosis? Option A, tension pneumothorax. Option B, cardiac tamponade. Option C, simple pneumothorax. Option D, hemothorax. Option E, pleural effusion. So the correct option here is option A, tension pneumothorax. So the spotting points here are stab wound, shortness of breath, engorged veins, and absent breath sounds. These are spotting points for this option. So correct option here is option A, tension pneumothorax. Question number 153. A 44-year-old patient comes with right hemiparesis exam. On examination, left-sided ptosis and left dilated pupil. Where is the lesion? Option A, cerebral infarct. Option B, cerebral infarct. Option C, medulla oblongata. Option D, pons. Option E, midbrain. So the correct option here is option E, midbrain. So this condition is Weber syndrome. It is characterized by ipsilateral oculomotor nerve palsy and contralateral hemiparesis. So the correct option here is option E, midbrain. Question number 154. A 50-year-old man has stab wound to his left anterior chest at the level of the fourth intercostal space. His blood pressure is 80 mmHg, pulse is 130 beats per neck veins are dilated, faint heart sound, and trachea is central. What is the most appropriate diagnosis? Option A, cardiac tamponade. Option B, diaphragmatic rupture. Option C, fractured ribs. Option D, tension pneumothorax. Option E, traumatic rupture of aorta. So the correct option here is option A, cardiac tamponade. It is the correct option. So hypotension, tachycardia, engorged neck veins, faint heart sounds or muffled heart sound, and central trachea. This is the classic Beck's triad. So the what is classic Beck's triads? It is hypotension, muffled heart sound, and raised JVP. So the correct option here is option A, cardiac tamponade. Question number 155. A 15-year-old boy has soft, painless swelling in the left scrotum, blue in color and compressible. What is the most appropriate next step? Option A, analgesia. Option B, antibiotic. Option C, biopsy. Option D, immediate surgery. Option E, reassurance. So the correct option here is option E, reassurance. Reassurance is the correct option here is. So the diagnosis here is varicocele. So varicocele is dilatation of piniform plexus veins. It is usually painless, compressible, and bluish in color. So management is reassurance. It is the correct option. Question number 156. A 12-year-old patient presents with copious diarrhea. Exam, urine output is low, mucous membrane is dry, skin turgor is low. What is the most appropriate initial management? Option A, antibiotic. Option B, anti-motility. Option C, anti-emetic. Option D, fluid replaceable. Option E, reassurance. So the correct option here is option D, fluid replacement. It is the correct option. And diagnosis is severe dehydration. So exam finding are low urine output, dry mucous membrane, and poor skin turgor. So low urine output, dry mucous membrane, and poor skin turgor. So these are symptoms of severe dehydration, and the correct option here is option D, fluid replacement. Question number 157. A 60-year-old smoker presents with cramp-like pain in calves relieved by rest and non-healing ulcer. On examination, cold extremities, lack of hair around ankles, absent distal pulses. What is the most probable diagnosis? Option A, intermittent claudication. Option B, chronic ischemia of the limbs. Option C, Burger disease. Option D, DVT. Option E, diabetes mellitus, DM. So the key here is chronic ischemia of the limbs. Option B is the correct. So intermittent claudication is symptom. It is not a diagnosis. So Burger disease, it occurs in heavy smokers less than 50 years age. So the correct option here is option B, chronic ischemia of the limbs. Question number 158. A healthy 13-year-old boy presents with recurrent episodes of facial tongue swelling and abdominal pain. His father has similar episodes. What is the most likely diagnosis? Option A, C1 esterase deficiency. Option B, HIV. Option C, mumps. Option D, sarcoidosis. Option E, Sjogren's syndrome. So the correct option here is option A, C1 esterase deficiency. And this condition is hereditary angioedema. So acquired angioedema is usually manifest after age 40. So in teenager with family history, hereditary form is most likely. So the correct option here is option A, C1 esterase deficiency. Question number 159. A 25-year-old had LSCS 24 hours ago for fetal distress, now intermittent vaginal bleeding. Midwife says retained placenta required manual removal. What is the most appropriate complication? Option A, retained POC. Option B, aspiration pneumonitis. Option C, endometritis. Option D, uterine rupture. Option E, DIC. So the correct option here is option C, endometritis. It is the correct option. So manual removal of placenta that causes increased risk of infection, intermittent vaginal bleeding, and raised temperature. So all point toward uterine infection, and that is endometritis. So the correct option is option C, endometritis. Question number 160. A 30-year-old woman has brief episodes of severe shooting pain in the rectum. Rectal exam and flexible sigmoidoscopy is normal. What is the most probable diagnosis? Option A, anal hematoma. Option B, anal fissure. Option C, rectal carcinoma. Option D, proctalgia fugax. Option E, piles. So the correct option here is Option D, proctalgia fugax. So normal rectal exam and sigmoidoscopy exclude structural causes. For example, fissure, carcinoma, piles, hematoma. So proctalgia fugax is a functional pain syndrome with sudden, sharp rectal pain episodes. So the correct option here is option D, proctalgia fugax. Question number 161. A 78-year-old male, diabetes mellitus, DM and HTN, fell and now unable to walk. X-ray shows fracture of neck, femur neck. What is the single most associated nerve injury? Option A, sciatic nerve. Option B, gluteal nerve. Option C, lateral peroneal nerve. Option D, tibial nerve. Option E, femoral nerve. So the findings here are unable to walk, deformity and tenderness over right hip. X-ray shows fracture of femur neck. So the correct option here is option A, sciatic nerve. So sciatic nerve injury may occur with hip fracture, though it is not very common. Question number 162. A 20-year-old man has had on collision, breathless, chest pain, fracture of 5 to 7 ribs. Chest X-ray confirms. What is the most appropriate initial action? Option A, antibiotics. Option B, analgesia. Option C, oxygen by mask. Option D, physiotherapy. Option E, refer to surgeon. So the correct option here is option C, oxygen by mask. So in chest trauma with rib fractures, the immediate priority is oxygenation. Pain relief is important, but oxygen comes first to prevent hypoxia. Question number 163. A 28-year-old man with headache, nosebleeds, pain in lower limbs on exertion, exam, radiofemoral delay, cold legs, weak pulse, mild systolic murmur. What is the most probable diagnosis? Option A, TOF. Option A, tetralogy of flu. Option B, atrial septal defect. Option C, ventricular septal defect. Option D, patent ductus arteriosus. Option E, coarctation of aorta. So the correct option here is option E, coarctation of aorta. It is the correct option. So headache plus nosebleed, hypertension in upper body, pain in legs on exertion, reduced blood supply to lower limbs, and radiofemoral delay. That is classic sign for coarctation of aorta. Cold legs, weak pulses, that is poor distal perfusion. And systolic murmur, it is due to turbulent flow across narrowed segment. So the correct option here is uh, option E, coarctation of aorta. Question number 164. A 23-year-old male has tonic-clonic seizure at college. His GCS is 12, blood pressure 120/77, heart rate 99. What is the most appropriate investigation? Option A, CT. Option B, MRI. Option C, serum blood glucose. Option D, serum drug levels. So the correct option is option C, serum blood glucose. It is the correct option. So hypoglycemia is common, urgent, and reversible cause of seizure. It must be excluded first because it can be rapidly corrected and it is life-saving. Other causes, structural, toxic, metabolic, can be investigated later if glucose is normal. So question number 165. Question number 165. A 20-year-old man complains of itching after viral infection. Numerous wheals appear after scratching, lasting up to an hour. What is the most probable diagnosis? Option A, uremia. Option B, urticaria. Option C, psychogenic itching. Option D, atopic eczema. Option E, primary biliary cirrhosis. So the correct option here is option B, urticaria. Wheals that appear after scratching and resolve within hours. are classic for urticaria. Other causes, eczema, uremia, and biliary cirrhosis, would present differently and are more resistantly. So the next question here is question 166. A 75-year-old lady with mitral valve replacement 13 years ago has recurrent breathlessness, prominent neck pulsation, abdominal pain, ankle swelling. What is the most probable diagnosis? Option A, aortic regurgitation. Option B, mitral regurgitation. Option C, mitral stenosis. Option E, option C, mitral stenosis. Option D, tricuspid regurgitation. And option E is pulmonary stenosis. So the correct option here is option D, tricuspid regurgitation. Tricuspid regurgitation is correct option. So breathlessness, that is right-sided heart failure symptom, prominent neck pulsation, giant V waves in JVP, abdominal pain, hepatic congestion, and ankle swelling, peripheral edema. These are spotting points for tricuspid regurgitation. So the correct option here is option D, tricuspid regurgitation. Question number 167. A 45-year-old type 1 diabetes mellitus had annual checkup, ophthalmoscopy, dot plot hemorrhage, hard exudate, cotton wool spots. Next step, option A, reassurance and annual screening only. Option B, urgent referral to ophthalmologist. Option C, laser therapy. Option D, non-urgent referral to ophthalmologist. Option E, nothing can be done. So the correct option is option D, non-urgent referral to the ophthalmologist. That is the correct option. This is pre-proliferative diabetic retinopathy. So question number 168. A 2-month baby with ambiguous genitalia, vomiting. Labs show sodium 125, potassium 6. What is the most likely diagnosis? Option A, Fragile X syndrome. Option B, Turner syndrome. Option C, Noonan syndrome. Option D, congenital adrenal hyperplasia. So the correct option here is option D, congenital adrenal hyperplasia. It is the correct option. So ambiguous genitalia, virilization due to excess androgens, hyponatremia plus hyperkalemia, salt wasting crisis from aldosterone deficiency, vomiting in infants with electrolyte imbalance is a classic representation. Question number 169. A 40-year-old man collapsed at home and died. He had type 2 diabetes mellitus, body mass index is 35. What is the most likely cause of death? Option A, myocardial infarction. Option B, diabetes mellitus. Option C, heart failure. Option D, pulmonary embolism. Option E, renal failure. So the correct option here is option A, myocardial infarction. So diabetes plus obesity, that is major risk factor for ischemic heart disease. In diabetics, myocardial infarction can be silent, painless due to autonomic neuropathy. So death may occur unnoticed. Question number 170. A 38-year-old patient presented with tingling, numbness, stridor, involuntary spasm of upper extremities. She had thyroid carcinoma surgery a week ago. What is the most likely diagnosis? Option A, thyroid stone. Option B, hyperparathyroidism. Option C, unilateral recurrent laryngeal nerve injury. Option D, external laryngeal nerve injury. Option E, hypocalcemia. The correct option is option E, hypocalcemia. So the patient had thyroid carcinoma and had recent surgery, and it presented with tingling, numbness, stridor, and involuntary spasm. So these sports Option E, hypocalcemia. Question number 171. A 50-year-old chronic smoker with chronic productive cough, shortness of breath, wheeze, labs show raised PCV, CXR shows more than 6 reps above diaphragm, ABG shows low PO2. What is the most likely diagnosis? Option A, interstitial lung disease. Option B, Wagner granulomatosis. Option C, cancer bronchi. Option D, COPD. Option E, amyloidosis. So all these presentation, productive cough, shortness of breath, and ABG shows low partial pressure of oxygen. So the correct option here is option D, COPD or chronic obstructive pulmonary disease is the correct option. Question number 172. A 44-year-old patient develops breathlessness and stridor minutes after extubation for thyroidectomy. History of long-standing goiter. What is the most likely diagnosis? Option A, thyroid storm. Option B, hematoma. Option C, unilateral recurrent laryngeal nerve injury. Option D, external laryngeal nerve injury. Option A, trichomalacia. So the correct option here is option B, hematoma. Question number 173. A 15-year-old boy presents with generalized edema. Urinalysis shows protein positive. EGFR shows 110. What is the most likely diagnosis? Option A, IgA nephropathy. Option B, membranous nephropathy. Option C, minimal change disease. Option D, PSGN. Option A, lupus nephritis. So the correct option here is option C, minimal change disease. So it is present in teenagers. So the boy is 15 years old. So the most likely option here is option C, minimal change disease. It is the correct option. Question number 174. A 72-year-old man on chemotherapy for small cell lung cancer 8 days post fourth cycle, cough with green sputum. Temperature is 37.6. Pores crept. WBC 1.1. Neutrophil 0.6. Platelets 89. What is the most appropriate management? Option A, broad spectrum antibiotics IV. Option B, broad spectrum antibiotics per oral. Option C, GCSF. Option D, postpone treatment until bacteriology results. Option E, reassure and send home. So the correct option here is option A, broad spectrum antibiotics IV. It is the most appropriate management option. Question number 175. A 25-year-old woman with type 1 diabetes mellitus delivered a 4.5 kg baby. Uterus well contracted. What is the most likely predisposing factor for postpartum hemorrhage? Option A, atonic uterus. Option B, cervical vaginal trauma. Option C, retained POC. Option D, large placental site. Option E, rupture uterus. So the correct option here is option D, large placental site. So 25-year-old woman with type 1 diabetes mellitus, she delivered a 4.5 kg baby. That is usually more than normal. Its weight is more than normal baby. So the correct option here is option D, large placental site. Question number 176. A 23-year-old lady presents with headache, photophobia, generalized non-blanching rash. What must be done immediately? Option A, IV benzyl penicillin. Option B, isolate patient. Option C, gown and mask. Option D, blood culture. So the correct option here is option A, IV benzyl penicillin. It is the correct option. Question number 177. A 4-year-old baby has generalized tonic-clonic seizure with fever, 39 degrees centigrade. Mother says similar episodes 3 to 4 times before. What is the most likely diagnosis? Option A, epilepsy. Option B, febrile convulsion. Option C, meningitis. Option D, encephalitis. Option E, hypoglycemia. So the correct option here is option B, febrile convulsion. So that these tonic-clonic seizure after fever. So these are because these seizure are because of fever. So the correct option here is option B, febrile convulsion. Question number 178. A 60-year-old man presents with sudden onset of severe tearing chest pain radiating to the back. Blood pressure is unequal in both arms. What is the most likely diagnosis? Option A, myocardial infarction. Option B, aortic dissection. Option C, pulmonary embolism. Option D, pericarditis. Option E, pneumothorax. So the correct option here is option B, aortic dissection. Question number 179. A 25-year-old woman presents with amenorrhea for 6 months. She has galactorrhea and headache. What is the most likely diagnosis? Option A, hypothyroidism. Option B, pituitary adenoma. Option C, PCOS. Option D, Sheehan's syndrome. Option E, premature ovarian failure. So the correct option here is option B, pituitary adenoma. It is the correct option. Question number 180. A 70-year-old man presents with progressive memory loss, disorientation, and personality changes. What is the most likely diagnosis? Option A, Alzheimer's disease. Option B, Parkinson's disease. Option C, Huntington's disease. Option D, vascular dementia. Option A, depression. So these finding, it is old man with progressive memory loss, disorientation, and personality changes. So these findings are likely indicating Alzheimer's disease. So the correct option is option A, Alzheimer's disease. Question number 181. Question number 181. A 40-year-old man presents with recurrent episodes of palpitations, sweating, and headache. Blood pressure is persistently high. What is the most likely diagnosis? Option A, pheochromocytoma. Option B, hyperthyroidism. Option C, essential hypertension. Option D, Cushing's syndrome. Option E, Cohen's syndrome. So the correct option here is option A, pheochromocytoma. So the recurrent episodes of palpitations, sweating, and headaches, these are because of pheochromocytoma. So the correct option here is option A, pheochromocytoma. Question number 182. A 55-year-old man presents with progressive dysphagia, initially to solids, then to liquids. He has weight loss. What is the most likely diagnosis? Option A, achalasia. Option B, esophageal carcinoma. Option C, esophageal stricture. Option D, esophageal web. Option E, Plummer-Vinson syndrome. So the correct option is option B, esophageal carcinoma. So dysphagia to both solid and liquid. These indicate it has esophageal carcinoma. Question number 183. A 30-year-old woman presents with heat intolerance, weight loss, tremor, and palpitations. What is the most likely diagnosis? Option A, hypothyroidism. Option B, thyrotoxicosis. Option C, pheochromocytoma. Option D, anxiety disorder. Option E, Cushing's syndrome. So the correct option here is option B, thyrotoxicosis. It is the correct option. So heat intolerance, weight loss, tremor, and palpitations. These indicate it has thyrotoxicosis. Question 194. A 65-year-old man presents with progressive exertional dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. What is the most likely diagnosis? Option A, COPD. Option B, left ventricular failure. Option C, right ventricular failure. Option D, pulmonary embolism. Option E, pneumonia. So the correct option is option B, left ventricular failure. So the exertional dyspnea, orthopnea, and paroxysmal nocturnal dyspnea. So these are signs of left ventricular failure. Question number 185. A 50-year-old woman presents with jaundice, pruritus, and pale stools. What is the most likely diagnosis? Option A, hemolytic anemia. Option B, hepatitis. Option C, obstructive jaundice. Option D, Gilbert syndrome. Option E, Dupin-Johnson syndrome. So the presence of jaundice, pruritus, and pale stools, these indicate obstructive jaundice. So the correct option is here is option C, obstructive jaundice. It is the correct option. Question number 186. A 35-year-old man presents with recurrent oral ulcers, genital ulcers, and uveitis. What is the most likely diagnosis? Option A, SLE. Option B, Behcet's disease. Option C, Ritter's syndrome. Option D, Crohn's disease. Option E, sarcoidosis. So the presence of oral ulcers and genital ulcers and uveitis. These three signs are present in Behcet's disease. Behcet's disease. So the option B, Behcet's disease, is the correct option. Question number 187. A 45-year-old man presents with tremor, rigidity, and bradykinesia. What is the most likely diagnosis? Option A, Parkinson's disease. Option B, Huntington's disease. Option C, Wilson's disease. Option D, essential tremor. Option E, multiple sclerosis. So the presence of tremor, rigidity, and bradykinesia. So all these are present in Parkinson's disease. So the correct option here is option A, Parkinson's disease. Question number 188. A 25-year-old woman presents with recurrent abdominal pain, alternating constipation and diarrhea. Colonoscopy is normal. What is the most likely diagnosis? Option A, IBS. Option B, IBD. Option C, colorectal carcinoma. Option D, diverticulitis. Option E, celiac disease. So the in this age, 25-year-old woman and with recurrent abdominal pain and constipation and diarrhea. So the correct option here is option A, IBS or irritable bowel syndrome. It is the correct option. Question number 189. A 60-year-old man presents with progressive hoarseness of voice and difficulty swallowing. He is a smoker. What is the most likely diagnosis? Option A, laryngeal carcinoma. Option B, vocal cord polyp. Option C, pharyngitis. Option D, GERD. Option E, esophageal carcinoma. So the in a 60-year-old man with progressive hoarseness of voice, difficulty swallowing, and he is also a smoker. So the likely diagnosis is option A, laryngeal carcinoma. Question number 190. A 50-year-old man presents with polyuria, polydipsia, and weight loss. Random blood glucose is 18 mol per liter. What is the most likely diagnosis? Option A, type 1 diabetes mellitus. Option B, type 2 diabetes mellitus. Option C, diabetes insipidus. Option D, Cushing's syndrome. Option E, pheochromocytoma. So the presence of polyuria and polydipsia and weight loss, and his age is he's old man. So in this age, so the most likely answer is type 2 diabetes mellitus. So the option B, type 2 diabetes mellitus, is the correct answer. Question number 191. A 70-year-old man presents with sudden painless loss of vision in one eye. Fundoscopy shows pale retina with cherry red spot. What is the most likely diagnosis? Option A, central retinal artery occlusion. Option B, central retinal vein occlusion. Option C, retinal detachment. Option D, glaucoma. Option E, optic neuritis. So the correct option here is option A, central retinal artery occlusion. CRAO is the correct option. Question number 192. A 30-year-old woman presents with malar rash, photosensitivity, and arthritis. What is the most likely diagnosis? Option A, rheumatoid arthritis. Option B, SLE. Option C, dermatomyositis. Option D, psoriasis. Option E, sarcoidosis. So the presence of malar rash, photosensitivity, and arthritis or joint pain, joint inflammation. So these all indicate systemic lupus erythematosus or SLE. So the correct option is option B, SLE. Question number 193. A 40-year-old man presents with recurrent epigastric pain that is relieved by food. Endoscopy shows duodenal ulcer. What is the most likely cause? So option A, H. pylori. So the correct option here is option A, H. pylori. So presence of epigastric pain that is relieved by food. And so the option A is the correct option, H. pylori. Question number 194. A 25-year-old woman presents with amenorrhea, hirsutism, and obesity. What is the most likely diagnosis? Option A, PCOS. Option B, hypothyroidism. Option C, Cushing's syndrome. Option D, premature ovarian failure. Option E, pituitary adenoma. So the presence of amenorrhea, hirsutism, and obesity, these are signs of polycystic ovarian syndrome. So the option A, PCOS, is the correct option. Question number 195. A 60-year-old man presents with progressive difficulty in initiating movement, mask-like face, and shuffling gait. What is the most likely diagnosis? Option A, Parkinson's disease. Option B, Huntington's disease. Option C, Wilson's disease. Option D, essential tremor. Option E, multiple sclerosis. So difficulty initiating movement, mask-like face, and shuffling gait. These are all signs in the Parkinson's disease. So the correct option here is option A, Parkinson's disease. Question number 196. A 45-year-old man presents with recurrent kidney stones. Labs shows hypercalcemia, hypophosphatemia. What is the most likely diagnosis? Option A, hyperparathyroidism. Option B, hypoparathyroidism. Option C, vitamin D deficiency. Option D, renal tubular acidosis. Option E, sarcoidosis. So the correct option here is option A, hyperparathyroidism, which is the correct option. Question number 197. A 30-year-old man presents with recurrent oral thrush, weight loss, and chronic diarrhea. What is the most likely diagnosis? Option A, HIV infection. Option B, Crohn's disease. Option C, ulcerative colitis. Option D, TB. Option E, sarcoidosis. So the presence of recurrent oral thrush, weight loss, and chronic diarrhea in a 30-year-old man, these are indicate HIV infection. So the correct option here is in a 30-year-old man, these all indicate HIV infection. So the correct option here is option A, HIV infection. Question number 198. A 50-year-old woman presents with proximal muscle weakness, heliotrope rash, and Gauthron's papules. What is the most likely diagnosis? Option A, dermatomyositis. Option B, polymyositis. Option C, SLE. Option D, rheumatoid arthritis. Option E, psoriasis. So the presence of proximal muscle weakness, heliotrope rash, and Gauthron papule, these indicate dermatomyositis. So the correct option here is option A, dermatomyositis. Question number 199. A 65-year-old man presents with progressive dysphagia, regurgitation, and halitosis. Barium swallow shows pharyngeal pouch. What is the most likely diagnosis? Option A, Zanger diverticulum. Option B, achalasia. Option C, esophageal carcinoma. Option D, esophageal stricture. Option E, GERD. So the correct option here is option A, Zenker's diverticulum. It is the correct option. Question number 200. A 40-year-old woman presents with recurrent episodes of chest pain, palpitations, and sweating. ECG is normal. What is the most likely diagnosis? Option A, panic disorder. Option B, angina. Option C, MI. Option D, GERD. Option E, pheochromocytoma. So in a 40-year-old woman, recurrent episode of chest pain, palpitation, and sweating. These are signs of panic disorder. So the correct option here is option A, panic disorder. Option A is the correct one.